Hey guys, this is my self-assessment on spinal cord injuries. The on-site review of spinal cord injuries and interventions were very helpful for me in addition to the provided resources that our instructors gave us throughout the last module and on our on-site visit. The review of innervations, how that looks functionally, and also doing the evaluation all of those were just so useful for me, and it really helped to kind of tie everything together. I really appreciated the on-site evaluation. It opened my eyes to being aware of what someone can do functionally despite their injury, and that can really help to target your evaluation questions, and it can change what your assessments are going to be as well. I think to be able to competently complete the evaluation, you need to know spinal cord innervations, how an injury presents differently depending on if it's a complete injury or if it is an incomplete injury, and then knowing how either of those is going to present functionally. So where the innervation is, if there's an injury there, what does that mean? What can't they do? What can they do? And that's going to tailor your eval as well. And on that note, we need to know what assessments are available to complete the evaluation appropriately, and then also understanding that the client is going to have a say themselves, and we need to take into consideration their context, their environment, what's important to them, because that's what makes it client-centered and best practice. So really tailoring those evaluations to each different client. And I also think it's important to understand the different evaluations that are available at your work site so that you know what you need walking into the evaluation, but also what's available to you. Other than entry-level education I received in CODA school and the assignments and everything we've done while being in Cabarrus, I don't have any clinical experience with spinal cord injuries. I worked in pediatrics for almost 5 years. So doing school-based therapy, I did not have any spinal cord injury patients or students. And then I work currently in a skilled nursing / outpatient setting, and we're a very quick turnaround, high level facility. And so I have not had any experience with spinal cord injury patients, and so having the clinical on-site piece of last time we were at school was very, 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 very helpful. So thank you again for that. I definitely need to further develop and secure my understanding of innervations and how that presents functionally. I know them, but I need to really commit it to my long-term memory so that when I see it in a chart, I just know what that means. And I know what it means functionally on paper so that I can prepare myself going into an evaluation. And when I get into that evaluation, it might look completely different, but at least I have everything that I would need if the patient presented how we would expect them to, or how we would assume them to present based on their injury site. So I feel that that is the one area that I really need to address personally. Practice skills, I feel that you can never be too good at anything. So I would like to further develop all of these skills: handling transfers, medical management, orthotic management, even my understanding of adaptive equipment. There's always new and improved adaptive equipment. So constantly learning and achieving to be better in each of those areas is something that I personally feel is important. But specifically, I think that transfers for higher level spinal cord injury patients is something that I would like to further develop my knowledge in addition to orthotic management. Those are just things that I don't have much experience or any in when it comes to spinal cord injury patients, so really understanding that is important. And then for resources, my company that I work for offers MedBridge as a free resource for all employees to access. And they have 21 continuing education courses via their on-site resource library. And those courses are something that I'm planning on watching and completing. There is a specific one that reviews functional occupational engagement based upon spinal cord injury, and so that is one that I'm definitely planning on taking advantage of. The American Journal of Occupational Therapy is always my go-to when I'm looking for professional evidence for an assignment or just to support an intervention that I'm looking at. And then I did find one journal article that seemed super useful. It's called The Occupational Therapy Treatment Time During Inpatient Spinal Cord Injury Rehab. It's in the Journal of Spinal Cord Medicine. This article seems super helpful. It goes over the expected treatment times for different levels of spinal cord injury and the benefits of each of those interventions. So that one seems very useful. I'm looking forward to delving into that deeper. But that's it. Thanks.